Question 1. When considering a school renovation project where ductwork is visibly coated with peeling paint from the 1970s, Mr. Alvarez must determine the safest approach to protect both occupants and workers before abatement begins. The HVAC system serves multiple classrooms and operates on a central return. Which action should he prioritize first? A. Apply encapsulant directly over the paint. B. Shut down and seal the HVAC system. C. Begin mechanical scraping inside ductwork. D. Install temporary HEPA filtration units in classrooms. Answer. Correct answer. B. Explanation. Shutting down and sealing the HVAC system prevents lead dust from spreading via the air distribution network, a critical first step per P and OSHA A standards. Encapsulation before hazard isolation risks contamination migration. Mechanical scraping inside duct without containment increases exposure risk. HEPA units in classrooms help as secondary to stopping airborne transport at its source. Practice requires stopping airflow to control contamination pathways before other measures. Question 2. The core principles of effective negative pressure containment require precise control of airflow direction. Isa Patel is supervising a multifamily housing abatement project and notes that her containment area has fluctuating pressure readings. What is the most appropriate corrective measure? Increase supply air to the containment area. B. Add an additional HEPA exhaust unit. C. Reduce exhaust flow to stabilize pressure. D. Seal secondary egress doors. Answer. Correct answer. B. Explanation. Additional HEPA exhaust increases negative pressure stability, ensuring air flows from clean to contaminated zones, preventing dust escape. Increasing supply air could reverse airflow, creating positive pressure. Reducing exhaust flow risks inadequate containment. Sealing secondary egress may reduce leaks but won't correct insufficient airflow volume. OSHA and NIOSH guidelines emphasize maintaining at least 0.2 inches water column negative pressure with reliable exhaust filtration. Question 3. Through careful analysis of worker exposure reports, Mr. Dorsey observes elevated blood lead levels in 2 technicians despite adherence PPE protocols. The work involved grinding paint at HVAC grills. Which factor is the most likely root cause? A. Improper respirator fit or seal. B. Overexposure due to work shift length. C. Inadequate surface wetting before grinding. D. Poorly maintained HEPA vacuums. Answer. Correct answer. A. Explanation. A compromised respirator fit is a common cause of unexpected lead exposure despite apparent PPE compliance, as per OSHA 1910.134. Extended shifts would exacerbate but not necessarily explain the spike if protection was adequate. Lack of wetting increases airborne dust but would affect all workers equally. Poor HEPA maintenance is possible, but direct inhalation risk from PUF remains the primary hazard source in such cases. Question 4. Given the circumstances of a hospital wing renovation where patient rooms remain occupied, Chen must finalize the occupant protection plan for lead abatement on HVAC diffusers. Which strategy aligns best with both safety and regulatory requirements? A. Conduct abatement during peak patient visitation hours. B. Relocate patients from affected rooms before work. C. Rely solely on temporary plastic sheeting barriers. D. Increase patient room ventilation during abatement. Answer. Correct answer. B. Explanation. Relocating patients eliminates direct exposure risk during abatement in line with EPA and CDC healthcare guidelines. Working during peak hours increases disturbance risk. Plastic barriers alone are insufficient for sensitive populations. Increasing ventilation without containment could spread lead dust. Hospital projects require eliminating occupant exposure whenever feasible, prioritizing relocation. Vulnerable individuals. Question 5. In a modern context of regulatory compliance, a lead abatement supervisor must ensure proper waste management from HVAC coil cleaning that produces lead-contaminated sludge. What is the correct procedural sequence? A. Neutralize, containerize, label, and transport to landfill. B. Containerize, label as hazardous waste, and arrange for approved disposal. C. Dry sludge bag and place with construction debris. D. Flush sludge into municipal wastewater after filtration. Answer. Correct answer. C. Explanation. Containerizing and labeling as hazardous waste, then using an approved disposal method is required under EPA hazardous waste guidelines. Neutralizing and landfilling may not comply without testing for DSLP limits. Drying and mixing with general debris risks environmental release and is prohibited. Flushing to wastewater can violate local discharge permits. The compliant method is containerizing, labeling, disposing through licensed facilities. Question 6. While examining a containment zone, Mr. Hollies observes that workers are using dry sweeping to clearly paint chips around HVAC registers. Which action should he take immediately? A. Replace dry sweeping with HEPA vacuuming. B. Wet down debris before sweeping. C. Seal off HVAC registers with tape. D. Assign additional PPE to workers. Answer. Correct answer. A. Explanation. HEPA vacuuming removes debris without generating airborne dust per OSHA and EPA best practices. Wet sweeping can still aerosolize fine particles. Sealing registers is preventive but does not address unsafe cleanup already occurring. Assigning extra PPE reduces inhalation risk but does not eliminate dust generation. The supervisor must stop unsafe methods and implement compliant cleaning immediately. Question 7. Across different scenarios involving clearance testing, Rivera must decide how to verify HVAC ducts are safe for reactivation after abatement. What is the most reliable method? A. Conduct air sampling with the HVAC running. B. Perform visual inspection only. C. Collect dust wipe samples from duct interiors. D. Operate HEPA filtration for 24 hours post-abatement. Answer. Correct answer. C. Explanation. Dust wipe sampling directly from duct interiors verifies whether lead dust remains as required for clearance in many jurisdictions. Air sampling with HVAC running can miss settled dust. Visual inspection alone is insufficient due to invisible contamination. HEPA filtration post-abatement improves air quality but does not confirm decontamination success. Proper clearance testing requires direct sampling of surfaces in question. Question 8. In response to a sudden containment breach in an office building HVAC planner, Mr. O'Neill must decide the priority action. Dust clouds are visible and negative pressure has dropped. What should he do first? A. Evacuate all non-essential personnel. B. Increase negative pressure immediately. C. Shut down the HVAC system and seal openings. D. Begin HEPA vacuuming the dust cloud. Answer. Correct answer. D. Explanation. Evacuating reduces exposure but does not stop contamination spread. Increasing negative pressure can help but won't contain existing airborne dust. Shutting down HVAC helps prevent further spread but leaves airborne dust circulating in the room. The most immediate step is to capture dust at the source using HEPA vacuuming, then address system shutdown and containment restoration. Question 9. The development of a site-specific safety plan for an HVAC lead abatement project in a manufacturing facility must address unique hazards. Which inclusion is most critical for worker protection? A. Mandatory lead awareness training. B. Daily blood lead monitoring for all workers. C. Respiratory protection program with fit testing. D. Prohibition of eating in work zones. Answer. Correct answer. A. Explanation. Lead awareness training ensures workers understand hazards, procedures, and PPE requirements, forming the foundation of safety compliance per OSHA 1926.62. Daily blood testing is excessive unless indicated by exposure data. Respiratory protection and fit testing are critical but stem from worker understanding gained through training. Eating prohibitions are important but secondary to comprehensive hazard comprehension. Question 10. From a practical standpoint, Mr. Green is assessing whether to encapsulate or remove lead-containing duct insulation. The material is brittle and fibers are becoming airborne during handling. What is the safer, compliant choice? A. Encapsulate with spray-on polymer. B. Remove insulation under full containment. C. Leave in place and increase filtration. D. Apply wetting agent and rewrap with new insulation. Answer. Correct answer. B. Explanation. Removal under full containment is necessary when insulation is deteriorating and releasing fibers per OSHA lead and asbestos cross-contamination guidance. Encapsulation is viable only for stable materials. Leaving it and adding filtration allows continued release risk. Wetting and rewrapping without removal traps hazards and can fail. If material continues to degrade, full removal ensures hazard elimination. Question 11. Demonstrated by an inspection at a large office complex, Mr. Lang finds several return air grills with deteriorated lead-based paint directly over carpeted floors. Occupants remain in adjacent areas. What is the most effective first containment step? A. Seal each grill with polyethylene sheeting and tape. B. Remove carpeting before abatement. C. Vacuum the carpet with a standard shop vac. D. Increase return airflow to reduce dust settlement. Answer. Correct answer. A. Explanation. Sealing grills with poly prevents dust from entering or exiting HVAC pathways, aligning with ARP dust control principles. Removing carpet before hazard isolation risks contamination spread. Shop vacuums are not HEPA-rated and can disperse fine particles. Increasing return airflow worsens hazard distribution. Initial containment prevents further dust migration before other remediation steps. Question 12. Under the assumption that duct interiors are coated with lead dust after years of operation in a contaminated facility, Foster must determine the correct decontamination protocol, which is the most compliant and effective approach. A. Wipe ducts with damp rags and household detergent. B. Perform dry brushing followed by HEPA vacuuming. C. Use HEPA vacuuming followed by wet wiping with approved cleaners. D. Apply chemical encapsulant without cleaning. Answer. Correct answer. C. Explanation. HEPA vacuuming followed by wet wiping ensures both loose and adhered dust is removed, meeting OSHA and NIOSH best practices for lead. Household detergents may not be effective for heavy contamination. Dry brushing aerosolizes dust, increasing exposure risk. Encapsulation without cleaning traps contamination but does not remove the hazard, posing long-term risks if coatings degrade. Question 13. The fundamental question is how to address worker rotation when high airborne lead levels are detected mid-project. Mr. Bryant is supervising a team with 10-hour shifts in a mechanical room. Which adjustment best reduces exposure in compliance with OSHA regulations? A. Reduce individual work time in the contaminated zone. B. Increase air changes in the room by opening exterior vents. C. Require double respiratory protection for each worker. D. Provide additional lead awareness training mid-project. Answer. Correct answer. A. Explanation. Limiting time in contaminated zones directly reduces cumulative exposure, a primary control per OSHA's hierarchy. Increasing ventilation may disrupt negative pressure containment. Double respirators are impractical and may not improve protection without proper fit. Additional training is valuable but not an immediate exposure control. Time rotation is an administrative control that quickly mitigates exposure. Question 14. In light of recent developments in waste tracking requirements, Kim is overseeing removal of lead-contaminated HVAC filters. What is the correct disposal step after placing them in leak-proof bags? A. Ship to a municipal landfill without paperwork. B. Complete a hazardous waste manifest before transport. C. Incinerate at the work site. D. Store on site until the project is finished. Answer. Correct answer. B. Explanation. Hazardous waste manifests are required for regulated materials, ensuring cradle-to-grave tracking per EPA and state laws. Sending to landfill without documentation violates regulations. On-site incineration is not allowed without permits. Storing waste until project completion risks accidental release and non-compliance. Proper documentation and licensed transport are mandatory for regulatory compliance. Question 15. To better understand the interaction between HVAC systems and lead migration, Mr. Clark simulates airflow in a contaminated attic duct network. Which factor most influences how lead dust travels through the system? A. Air velocity within ducts. B. Type of insulation on duct exteriors. C. Color of duct material. D. Age of HVAC unit. Answer. Correct answer. A. Explanation. Air velocity determines particle suspension and transport, directly affecting dust migration per ASHRAE airflow dynamics. Insulation type may affect surface temperature but not primary dust transport. Duct color has no relevance to airflow mechanics. Unit age can influence efficiency but not the fundamental physics of dust travel. Controlling airflow speed and filtration is key to hazard control. Question 16. The growing trend in lead abatement projects is integrating real-time air monitoring. During HVAC register abatement, ISTA notices readings spike above the action level. What is the immediate corrective action? A. Halt work and investigate containment breach. B. Continue work but increase respirator protection. C. Isolate the monitor to prevent interference. D. Move the monitor to another location. Answer. Correct answer. A. Explanation. Stopping work prevents further exposure and allows investigation per OSHA lead standard 1926.62. Increasing respirator protection without identifying the cause may allow contamination spread. Isolating or moving the monitor ignores the hazard and risks false compliance. Immediate cessation ensures worker safety and prevents environmental spread until the breach is corrected. Question 17. By comparing two abatement crews, Alan notices one group achieves faster clearance in HVAC plenum projects. Which factor most likely explains their success? A. Use of high-capacity HEPA filtration during work. B. Shorter breaks to increase work efficiency. C. Working with a PPE for greater mobility. D. Dry removal of loose debris. Answer. Correct answer. A. Explanation. High-capacity HEPA filtration removes airborne particles, continuously improving clearance success rates per EPA and NIOSH guidance. Shorter breaks may increase productivity but not cleaning quality. Working with it PPE endangers workers and violates OSHA law. Dry removal without containment generates dust, prolonging cleanup. Proper engineering controls remain the most effective clearance factor. Question 18. The common thread among failed HVAC lead abatement projects is inadequate post-work verification. Which method provides the most defensible clearance documentation? A. Supervisor's written statement of cleanliness. B. Laboratory analysis of dust wipe samples. C. Visual inspection with photographs. D. Air sampling alone. Answer. Correct answer. B. Explanation. Laboratory analyzed dust wipes provide quantifiable, defensible clearance data as required in many jurisdictions. Supervisor statements and photos lack quantitative proof. Visual inspections can miss microscopic hazards. Air sampling measures airborne concentration at one moment and may miss settled dust. Dust wipe analysis gives direct, measurable evidence of surface decontamination. Question 19. For the purpose of ensuring HVAC safety after lead abatement, ISTA Peters plans system restart. Which step is critical before reactivating airflow? A. Remove all containment barriers. B. Replace all HVAC filters with HEPA-rated units. C. Operate the system at maximum speed for 1 hour. D. Leave access panels open during first operation. Answer. Correct answer. D. Explanation. Replacing filters with HEPA-rated units ensures any residual dust is captured before distribution. Removing containment first risks spread. Running at maximum speed without filtration disperses contaminants. Leaving access panels open exposes dust to occupied areas. Proper filter replacement before startup is essential per post-abatement commissioning standards. Question 20. Taking into account a facility's history of lead exposure and recent HVAC retrofits, NOVAC must design worker training session. Which focus area will most effectively reduce lead hazards during the upcoming ductwork removal? A. Correct glove material selection for chemical resistance. B. Proper sequencing of containment setup and dismantling. C. Ladder safety for accessing high duct runs. D. Lockout-egg-out procedures for HVAC power sources. Answer. Correct answer. B. Explanation. Containment sequencing ensures dust is controlled from the start and safely removed after work, directly impacting hazard spread. Gov chemical resistance is relevant for solvents but not primary in lead control. Ladder safety is important for fall prevention but unrelated to dust control. Lockout-egg-out is vital for equipment safety but not the primary factor in contamination prevention during duct removal. Question 21. While it is true that HVAC filters can trap lead dust, Mr. Jefferson notices high lead levels in adjacent rooms after filter replacement, which is the most likely underlying cause. A. Workers handled filters without proper PPE. B. FO bypassed the filters due to improper sealing. C. Filters were changed too frequently. D. HVAC system was operated at low fan speed. Answer. Correct answer. B. Explanation. Improperly sealed filters allow air and lead dust to bypass filtration, spreading contamination despite new filters. Handling without PPE poses exposure but not room-to-room migration. Frequent filter changes do not increase airborne lead. Low fan speed reduces distribution but does not explain elevated levels. Proper sealing and correct installation are critical per HRConquer guidelines. Question 22. Considering the evidence of airborne lead spikes during abatement, Whitman is tasked with implementing engineering controls. Which action most directly reduces airborne contamination? A. Increasing negative pressure with HEPA exhaust. B. Providing additional respirators to workers. C. Scheduling shorter work shifts. D. Using warning signage around the site. Answer. Correct answer. A. Explanation. Negative pressure systems with HEPA exhaust actively remove airborne dust and prevent migration, addressing the source of exposure. Additional respirators protect workers but do not reduce ambient dust. Shorter shifts limit exposure time but do not eliminate airborne hazards. Signage warns but does not control contamination. Engineering controls are primary measures per OSHA hierarchy. Question 23. From a practical standpoint, Mr. Romero needs to determine the best method to clone HVAC registers heavily contaminated with lead dust. Which approach complies with best practices? A. Wet wiping after HEPA vacuuming. B. Dry brushing to remove loose debris. C. Compressed air blow-off into containment. D. Applying a temporary encapsulant without cleaning. Answer. Correct answer. A. Explanation. HEPA vacuuming followed by wet wiping ensures both loose and settled dust is removed, preventing airborne release. Dry brushing generates dust and is non-compliant. Compressed air disperses lead particles into occupied spaces. Encapsulant without cleaning traps contamination, leaving a persistent hazard. Proper removal ensures regulatory compliance and worker safety. Question 24. In terms of worker health monitoring, Delgado observes fluctuating blood lead levels despite PPE age. What is the most important next step? A. Reassess respirator fit and training. B. Require workers to change PPE more frequently. C. Switch to a high-rated respirator type. D. Reduce work hours for all personnel. Answer. Correct answer. C. Explanation. Switching to a high-rated respirator ensures airborne particles are properly filtered, addressing potential breakthrough due to insufficient protection. Frequent PPE changes without evaluating filtration efficiency may be ineffective. Reducing hours mitigates exposure but does not solve inadequate respiratory protection. Fit reassessment is important but may not suffice if filter rating is inadequate. Question 25. Given the circumstances of abating a legacy HVAC system, Mr. Thompson must decide whether to encapsulate or remove brittle lead insulation. What is the safest choice? Encapsulate immediately to prevent dust release. B. Remove insulation under full containment. C. Cover insulation with plastic sheeting and continue operation. D. Spray water to suppress fibers without containment. Answer. Correct answer. B. Explanation. Full containment removal eliminates airborne fibers, reducing long-term risk as per EPA and OSHA guidance. Encapsulation is only appropriate for stable materials. Covering insulation without removal risks ongoing contamination. Water spraying without containment can spread dust and expose workers. Complete removal ensures hazard control. Question 26. To what degree does inadequate containment affect post-abatement clearance? Is Fisher notices dust accumulation outside the work area. Which factor primarily explains this? A. Negative pressure was insufficient. B. Workers removed PPE incorrectly. C. HEPA filtration units were oversized. D. Visual inspections were too frequent. Answer. Correct answer. A. Explanation. Inadequate negative pressure allows lead dust to escape containment, directly affecting clearance success. Improper PPE removal may expose workers but doesn't explain off-site dust. Oversized HEPA units improve airflow and not hazard. Frequent visual inspections help detect issues but don't cause dust spread. Negative pressure control is fundamental per OSHA standards. Question 27. Based on the information from an HVAC abatement audit, is the LIN notes inconsistent wetting during scraping operations? Which risk is most concerning? A. Airborne lead dust exceeding permissible levels. B. Water damage to HVAC insulation. C. Worker slips due to wet floors. D. Prolonged project timeline. Answer. Correct answer. A. Explanation. Inconsistent wetting during scraping increases airborne dust. The primary route of lead exposure violating OSHA lead standard. Water damage is secondary and controllable. Slips are minor hazards compared to inhalation. Project delays do not pose direct health risks. Wetting is essential to suppress dust and protect workers per European OSHA guidance. Question 20. Throughout the course of abating, a SKU HVAC system Owens observes workers skipping decontamination of hand tools between containment zones. What is the most appropriate corrective action? A. Reinforce tool cleaning procedures and supervision. B. Assign personal tools to each worker. C. Limit work hours to reduce cross-contamination. D. Cover tools with plastic wrap during work. Answer. Correct answer. C. Explanation. Limiting work hours alone doesn't prevent cross-contamination. The most effective method is reinforcing proper tool cleaning and supervision, ensuring dust is not transferred between zones. Assigning personal tools may reduce risk but doesn't eliminate contamination if tools are shared. Covering tools is temporary and insufficient. Standardized decontamination procedures are essential for hazard control. Question 29. From multiple perspectives, post-abatement verification is critical for HVAC systems. HRConquer must choose a reliable clearance method. Which approach aligns with industry best practice? A. Dust wipe sampling from duct surfaces analyzed in a lab. B. Supervisory inspection with photographic evidence. C. Visual inspection after HEPA vacuuming. D. Measuring air velocity across diffusers. Answer. Correct answer. C. Explanation. Laboratory dust wipe sampling provides quantifiable evidence of lead removal and is widely recognized as compliant per OPI guidelines. Visual inspection alone may not detect residual dust. Photos document but don't measure contamination. Air velocity measurements assess airflow but not contamination levels. Direct sampling is the most defensible verification. Question 30. When faced with unexpected lead dust migration from HVAC plenums into occupied areas, Blake must act quickly. Which immediate step addresses the hazard? A. Increase negative pressure and contain the source. B. Evacuate personnel and continue abatement. C. Begin vacuuming occupied areas with standard vacuums. D. Install additional HEPA units in the adjacent rooms. Answer. Correct answer. D. Explanation. Installing HEPA filtration in affected rooms immediately reduces airborne exposure while containment is restored. Increasing negative pressure at the source is critical but may require setup time. Evacuating personnel addresses exposure but not dust in place. Standard vacuums disperse lead dust. Immediate air cleaning with HEPA units is essential for worker and occupant safety.